Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
And hello again, everyone, and thanks very much for joining us for Arkansas Week in our state, the coronavirus, and communities of color. Is the immunization imperative persuasive? Or is suspicion and resentment still inhibiting African American, Arkansans, Latinos, Asians, Pacific Islanders? Well, we'll update that story in a few moments. But first, the conservative ascendancy in Arkansas, not in generations, as the Republican Party racked up so many victories in a single legislative session. Not all of those wins have been to the Republican governor's liking, and certainly not to a shrunken Democratic base and its customary allies. An assessment now from one of the leaders of the General Assembly's controlling bloc, Senator Mark Johnson, Republican of Ferndale. And from the opposite corner, at least on many issues, Holly Dixon, Executive Director of the Arkansas branch of the American Civil Liberties Union. And thanks to both of you for coming in, Senator Johnson. Thanks for risking the studio. I think, although both of us, I think, have had both of my shots. I had no complications, so at least I can only speak for the Pfizer version, but so far, so good. Well, we're all healthy, at least for the moment. But let me run through these very quick. On matters of sexual identity, abortion, gender identity, election laws, firearms, voting rights. You have been on the prevailing side. And the prevailing side has been I think it's fair to say, a hard right Republican side. What is happening here? Well, Steve, I think that it's not just about what's happening with the Republicans. It's partially about what's happening with the other party. I don't think people of Arkansas philosophically have changed a lot. The parties have certainly changed. We go back to the days when people could say, well, the Democrats, they're conservative Democrats, they're Arkansas Democrats, and they were in large part. And now many of them that are still alive that I've gotten to know identify as Republicans because the parties have shifted, especially at the national level, so far to the Democrats have gone so far to the left that it's not following what most people, at least, and a majority, I'm not saying everyone, of course, would call Arkansas values. And I think some of these social issues that we've seen are especially indicative of that. Well, you may have guaranteed Ms. Dixon's job, at least for the near term anyway, for the next couple of years, because ACLU has vowed to take your side to court on several of these issues. Are you confident that they can withstand a constitutional challenge? You've survived in the political arena. Can you survive in the judicial? I'm confident we can on most of those things, Steve. Sadly, when you go into federal court, you don't know what you're going to get. We have like one federal judge, I won't name her, but she seems to get all the cases dealing with abortion issues and seems to always rule against the state of Arkansas and often gets overturned at the appellate level. So I've learned a long time ago, don't predict what judges will do, but as far as the support of the people of Arkansas, I think we have an overwhelming amount of support. I think the people of Arkansas are generally well to the right of center. That doesn't mean on every issue, of course. We have some that are more fiscal conservatives and less social conservatives, but I think that when you talk about absolute open abortion, doesn't matter the issue, doesn't matter the age, if the baby is almost born, you can still kill it. I think that the people of Arkansas are against that type of thing. And I think when we see these positions taken at the national level, this slippery slope toward some of the leftist positions, I think a lot of people in Arkansas have dug in their heels and say, no, this is wrong. It violates common sense and it violates my particular moral values. And consequently, they're voting for the Republican candidates who have those things in their platform. Well, let me go to Holly Dixon. Ms. Dixon, go ahead and your response to the senator. You're online with us now.
Thank you. Thanks for having me with you today. I would question the label of this being a conservative platform at all, because conservative platform would be limited government, staying out of the lives of the people of the state of Arkansas. And as a lifelong Arkansan, I feel like I'm pretty in touch with Arkansans' values as well. And I don't see folks clamoring for politicians to push social issues of the day as priorities in the state legislature. I think Arkansans want to be left alone. They don't want divisive policies. They want things that actually solve problems that we have. Healthcare, education, roads, issues with the pandemic, racial justice reform, and we're not seeing that out of this General Assembly. Also, no, there's not abortion until babies are almost alive. The Roe versus Wade framework has been in place for years, since 1973, that abortion can be banned post-viability, and that is still the law, and that's why the state continually loses in court. That is the standard, and I understand that some politicians don't agree with that legal standard, but that is the standard that is in place. And so that's why you see the outcomes that you do, and rarely are those trial court decisions overturned at the federal appellate level.
Well, you're going to need some plaintiffs, and I suspect that you can find them. Is there what is the ACLU's priority? What are we likely to see in the courtroom first?
The first thing we're going to see in the courtroom is a challenge to House Bill 1570, which bans gender-affirming care for all trans youth in Arkansas, and it bans healthcare providers from even providing referrals for gender-affirming care. We've heard from every major medical organization across this nation and in this state, as well as healthcare providers who treat these patients and these patients' parents, that this bill is contrary to the health of young Arkansans. And nonetheless, the legislature overwhelmingly voted to ban this health care. It's dangerous, it's deadly, and we'll be going to court in that as quickly as possible. We were not going to have trouble finding plaintiffs. We've been hearing from terrified families for months.
Well, Senator, let me come back to you for a second. You're, in fact, the Senate or the legislature voted to override. You're bucking your own governor, the governor of your own party here, who vetoed 1570.
Yes, he did, and he also was criticized strongly by former President Trump just yesterday over that. And Steve, and I have to take great issue with Holly's characterization of killing a baby in the womb, that they're almost alive. We've learned through the years, it took a while for us to come around sometimes, but the technology that lets you see a baby in the womb sucking its thumb, that's a human being, and that's where we tend to differ with some of the so-called pro-choice people on that. The same thing with this issue in 1570 of the gender reassignment surgery and the puberty blockers and the other things. We don't see that as health care. We see that as a life-changing, probably permanent, possibly life-ending change in some cases. She talks like the medical profession is unanimous in their position on this. They are not. Many doctors say this is a terrible thing. Actually, one of the leading people on the sex change surgery was a doctor at Johns Hopkins University who, after years of study, has stepped forth and basically said, you know, we were wrong. There's still a lot of psychological problems. This doesn't solve people's problems that are confused about gender. And once again, this is important for everyone to know. This bill doesn't have anything to do with what an adult does related to sex change surgery or anything like that. This is about children.
Well, this was brought up, Senator. I mean, the surgical procedures are not being implemented or performed on minors.
This is in the bill. Whatever that you say, or the bill covers that. And what it basically says is, when you're a kid, don't abuse it. Don't abuse children. Now, some people say, oh, well, this child, he decided he's now a girl. So, we've got to affirm that in every way we can, both medically, chemically, surgically, or whatever.
But should this be a political issue, though?
I think it absolutely should be. We don't let people give alcohol to people underage. We've even gone so far. You and I remember young people smoked in high school. We've banned that. We're now stepping forth and saying we're going to protect children against something that is bad for children generally. And the idea that someone would make a life-altering decision that's irreparable for a minor is just abhorrent to most of us. And I think the vote, the original vote and the vote to override the governor's veto is indicative of that. It's indicative of the feelings of the people of Arkansas.
Well, let me give Holly Dixon some more time here, in fairness. Ms. Dixon.
So it was very clear, even sponsors of the bill said no one is performing gender-affirming surgery on children in the state of Arkansas. This bill bans puberty blockers and hormone treatment and other care for transgender youth. It also invites insurance companies to deny coverage for gender-affirming care for youth and adults. So no one's making life-altering decisions that are non-reversible on behalf of children. And this is what physicians who treat these children and parents lined up time and time again within their allotted 2 minutes tried to explain to the members of the Arkansas General Assembly. And it is an incredible overreach on behalf of the legislature to substitute its judgment for that of the child, it's the child's parents, and the caregivers who know best about what's going on in that individual child's lives. It's a sweeping intrusion on their right to privacy, on their right to parental autonomy, and due process. We're issuing a blanket ban that is harmful on this type of health care, and it's indicative of the other types of actions that we've been seeing pass through the General Assembly this session.
Well, let me go back to Senator Johnson here on the broader sphere, on the broader matter. To the extent that they can, or that they are separate or can be separated, what's the difference here? Is it politics? Is it culture? Is one shaping the other, or is there a certain synergy here, or what?
Steve, I don't think you can separate those things. We have philosophies. I'm talking about both Democrats, Republicans, and even moderates within those groups. We have philosophies, but we also hear from our constituents. And they overwhelmingly supported House Bill 1570, and we actually probably got more support after the governor's veto. I think it was a shock to them. He appeared on Tucker Carlson's show on Fox 3 nights ago, I think, and Tucker Carlson really seriously took him to task as a so-called conservative Republican. And I think that shocked a lot of our Republicans around the state to see Governor Hutchinson capitulate in some ways to some of the corporate interests that are pushing this. And we know what it is.
He is capitulate. Is that your...
The governor said he didn't get any calls from any corporate people, but Tucker Carlson pressed him on that issue, and the following night actually said that he was not telling the truth on that. But and I don't know who the governor talked to. I do know that I got emails from corporate interests saying, we want this because it'll help us recruit more people from out of state that believe this way. And I just don't think that's a reasonable way to make any kind of a public policy decision.
All right, Holly Dixon, if the senator is correct here and the politics and the culture are one and the same, what option does that leave the AC? This is purely going to be fought out in the judicial arena, he seems to be saying, the senator.
Well, yes, if they pass a law that's unconstitutional, then we go to the judicial branch. However, these are not bills that were conceived in Arkansas or pushed by Arkansas constituents. It's a coordinated effort from groups outside the state of Arkansas. That's why we're seeing the same bills in 26 other states. That's why Alabama has a similar bill to 1570. That's why Tennessee has a bill similar to 1570. And if corporations have said anything about 1570 and its ban on trans youth health care, I'd be keen to hear about it. I've only heard them speaking out about a broader health care refusal conscience bill that they opposed, and speaking up on hate crimes. I've not heard any corporations speak to the health care denial for trans kids.
Senator, on hate crimes, the administration's hate crime, it appears to be settling for the one that's making its way through.
That's a weird bill, Steve. I voted against it. It's really, it's just someone looking for a way to check the box, whether it's at the our large corporations want to be able to say, see, we have a hate crimes bill. And in other cases, it's got some good things in it. It talks about truth in sentencing, and it's my words, not the legislation. But to come back to what Holly's talking about, quickly, the ACLU likes to throw out unconstitutional, and we conservatives see babies as human beings, just like in the 19th century, people saw black people as chattel and not human beings. We evolved on that just like we have on the issue of abortion. We know that these unborn babies are human beings just like black people were in 1859.
I've got to give Ms. Dixon the last word because you had the first word, Senator.
Well, we do agree that the 622, the current hate crimes, is a weird bill, and also we do not support that. But you know, Arkansas was the last state to pass a state civil rights law, and we ought to be including gender identity and sexual orientation in our state civil rights law. So I think that's the problem with us trying to pass a hate crimes law now, is we can't even agree that people should have civil rights at all if they're LGBTQ, part of the LGBTQ community. But I also think that there's a lot more going on here. And this is not just about attacks on women's reproductive health care or on transgender kids and transgender Arkansans. I think it's cover for all of the attacks on voting rights and free speech and criminalizing the poor and interfering with education and all the other individual liberties and personal autonomy that we have, because we're seeing power grabs from the people, from cities and counties and local control. And it's a very broad, sweeping set of bills that are doing this.
And we have to end it there because we're simply out of time. Holly Dixon of the ACLU, Senator Mark Johnson, thanks very much for being with us. Thanks to you both. And come back soon, both of you. And we'll be right back. And we're back now with our segment on Arkansas and COVID. It's accepted in every branch of medicine. The low income are especially prone to ailments such as diabetes, hypertension, coronary disease. They are less likely to have easy access to clinical care. They are more likely to live in close quarters with extended family, sometimes friends. Thus are the low income especially susceptible to viral actors such as COVID-19. Also, disproportionately represented African Americans, Asian Americans, Pacific Islanders, Latinos, Native Americans. So, joining us now to assess the situation, nurse practitioner Barbara McDonald of the University of Arkansas for Medical Sciences. She's been on the front lines of the immunization campaign from the start. And LaShannon Spencer, CEO of Community Health Centers of Arkansas. Both of you, thank you very much for coming aboard. Ms. McDonald, let's begin with you. Do we continue to see this disparity in the immunization rates among people of color in Arkansas?
I think that we did have a disparity, but we have been doing a lot of outreach to try and go to the underserved communities. And so I'm seeing a greater percentage of African Americans and Hispanics overall getting vaccinated now.
So we are making some headway in that regard.
Yes, sir.
LaShannon, what's at work here? Outreach? We tailored our approach or what?
And that's a good question. We've actually tailored our approach, and it hasn't been one single entity, but it's been about partnership and entities actually coming together in order to create a greater sense of awareness and provide the necessary education that's actually needed. So the numbers have been improving across the state.
Let me go back to Ms. McDonald for a second. What the resistance to immunization, to vaccination, what form is it taking? What are you seeing? What are you hearing out there?
I'm hearing that some people are not actually looking into the actual data and the research, and so they're going according to gossip and not getting the knowledge. And then the other thing I think is access. So meaning that sometimes people don't have a means to get to the location, or where they don't have Wi-Fi access, so they don't have the stability of that.
Well, in terms of reluctance to take the vaccine when it is available, the skepticism, what's at work there? Myth, fear?
I think it's fear and myth, but I think now that we've opened up the availability for everybody to get vaccinated, as their leaders and the people that they admire, that they will then start to be more willing and open to getting vaccinated.
Yeah, Ms. Spencer, it's credibility, I think, that counts so often.
And you're absolutely correct. It is the credibility. At our particular health center over in the eastern part of our state, East Arkansas, when we talked to many of the patients that stood in line to be vaccinated just on April 1st, they talked about the built-in trust that they actually had with the clinicians and the staff at East Arkansas Family Health Center. So that definitely makes a difference to have that built-in trust. Not only just from that clinic or health center, but also based on the leaders that the community leaders as well.
Well, let me ask both of you this: the numbers that I'm seeing on the disparity anyway in overall immunization rates. It's not true only in the South, but it's true especially. It would seem to be true especially in the South. Ms. Spencer?
You're absolutely correct. And when you start looking at the data, you have so many states that really gets down into the data when it comes to minorities. It's an issue. And I've said it before on your show, we need to have a better system of actually capturing the data in order to really improve the outcomes. When you start looking at Mississippi and the uptake in the vaccine, especially when you start looking at North Carolina, just recently, the Kaiser actually did a report and actually listed out the racial uptake within the vaccine. I wish that it is my hope one day that Arkansas will be able to provide such clear picture of the data when it comes to race as well.
Well, I am also reading some data that indicates there is, odd as it may sound, although not especially given the temper of the time, there is a distinction or a difference in political acceptance by partisan factor.
It is. And I forgot to thank you for allowing me to actually be on your show. But when we really start looking at Arkansas, so you talk about the hesitancy among African Americans. We still have that greater hesitancy among rural communities as well. And when I say rural, white rural men, politics has really made an impact or had an impact on the uptake of vaccine with white rural men. And then it just gives me great pause because we need to reach herd immunity. And if we don't, we will continue to face an uptick in positive cases.
Yeah, Barbara McDonald, are you picking that up among white rural males anyway?
Yes, most definitely. Within my circle and within just them not wanting to get vaccinated. Wives, patients coming in, they're like, I'm here to get it, but I can't get my spouse to come.
Well, I mean, what is this skepticism toward government, suspicion of government, or misplaced masculinity, Hemingway syndrome, or what?
It's a misplace of government, and it's politics at hand, and I believe it just started, and it's become more political than thinking about the health outcome, not only just of yourself or your family, as well as your community. We've allowed politics to impact where we are right now pertaining to COVID-19.
Ms. McDonald, what's the antidote to this? No pun intended.
I think honestly, it's going to be communication and being out there and being present, and then peer pressure. I think all of that will combine to help get more people vaccinated.
Well, in terms of the latest data that I was able to capture from the CDC is that Arkansas has done a somewhat good job of immunizing those 65 or older, but not only here, but across the country. The demographic group that's really taking it on the chin now are those 35 and younger. Ms. McDonald, are you seeing that?
I would say yes, although now on my most recent travels, like to Henderson College, I saw that the coaches and the teachers were able to encourage their students to go ahead and get vaccinated. I also saw when we were at our Philander Smith, which is a traditionally, historically Black college, where the peers were able to get their classmates to come and get vaccinated. So again, I think that the presence of those that they trust and peer pressure will get more people vaccinated.
Well, I said it this morning, perhaps I should correct myself, Ms. Spencer, because I said we've done a fair job of immunizing. The latest CDC that I'm seeing is that of those eligible in Arkansas, only about 38% have been immunized to at least one dose. And this vaccine's been available now for 6 weeks or longer.
Even though the great outpour and educating, we're really going to have to really explore together collectively more avenues in order to increase that number, or to increase the education rate when it comes to the COVID-19 vaccine. It's still there, and we are all working as partners to try to figure out the best solution to make sure that everyone's vaccinated. The supply is there. So it's not a matter of, like it was months ago, not having enough vaccines. We actually have enough vaccines in the state now. It's just a matter of individuals making up their minds to actually take the vaccine.
Got to end it there because we're out of time. Thanks so much, LaShannon Spencer. Barbara McDonald, thank you for your time. And come back soon. And we'll be back next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.